This is Dr. Daniel Paul with Easy Orthopedics, and today I'm going to be asking a question that I seem to get is, will my piriformis syndrome go away? The short answer is yes, it can, if you treat it correctly. So before we get into that, I think it's good to talk about, well, what is piriformis syndrome? Well, what is the piriformis? So the piriformis is a muscle, probably about this big, that sits kind of on the outside and deep kind of in your butt area. And it's this muscle, it rotates your leg outwards a little bit. It's a small muscle. The issue is that you have a gigantic nerve called the sciatic nerve, which comes underneath this muscle. So if the muscle's sitting on top of here, the nerve is coming through here. And with piriformis syndrome, if that muscle gets tight, it'll start squeezing that nerve. And the sciatic nerve, as well as any other nerve in the body, they do not like to be squeezed or pushed. And what happens is they react to that, and it usually causes pain all the way down the length of the nerve. Now, the sciatic nerve is long. It's the biggest nerve in the body. So that pain can travel from your butt all the way down to your foot, and it can be debilitating. So that's what piriformis syndrome is. So the first step in getting rid of your piriformis syndrome is to make sure that you really do have piriformis syndrome. So sometimes people will have piriformis syndrome that's really coming from their back, or they'll be diagnosed to have back pain that's coming from their piriformis. So it's important to get an accurate diagnosis from your doctor. Some of that may involve imaging, someone who has pain traveling down the back of their legs, which is called sciatic symptoms, which just means the sciatic nerve is irritated. And they'll get an MRI and there's nothing there. And then it turns out it's coming from a tight muscle in their butt called the piriformis. So your doctor can test for that by kind of pushing in that area and doing some other maneuvers. So that's the first step. Once you get diagnosed with that, what do you do from there? Well, the best treatment for piriformis syndrome is stretching and physical therapy. You can also use anti-inflammatories, but the idea is that you stretch that nerve out so it's not so tight and it's not pushing. You stretch that muscle out, the piriformis, so it's not so tight and it's not pressing on your nerve. And if you do that over a long enough period of time, the nerve will relax and your symptoms should go away. Rarely people will get steroid injection into that area. It is one of the more difficult steroid injections to do because it's not like a joint space that you just have to get into. You're going deep into muscles, depending on how big somebody is, to inject around the nerve. So not something that's commonly done, but it has been done and can help people. If steroid injection doesn't work, there is a surgical release for it. It's super rare, not done that often, although it does get done. If you have a big surgery center, it maybe gets done there once a year compared to thousands of hip scopes, knee scopes and shoulder scopes and that sort of thing. So that is a possibility, but most people don't need the injection. Most people don't need surgery. They just need an accurate diagnosis and some stretching. So I hope that was helpful to you. If you have any questions, feel free to leave them below and I'll try my best to respond. And otherwise, I'll keep making these videos and take it easy.